Hello everyone. Today's video is about MSM, using that for high-dose sulfur therapy. As per usual, nothing that I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. And if at some point you wouldn't mind, please taking a quick moment to like, share, subscribe, and or post a quick comment on the video. I'd really appreciate it. So thanks in advance for taking a second to do that. So I wanted to post a quick video just because I'm just so excited about MSM, using that as a high-dose sulfur therapy. I had a few patients this week where I followed up with them, and that was the main intervention that we were had started, or the most recent intervention that we started, and I'm just getting lots and lots of good feedback. So as for context, if you're like, what the heck is high-dose sulfur therapy and what does that have to do with MSM, I'd invite you to please look up the recent podcast interview episode that I posted that I spoke with Dr. Kathleen Janelle. She's a naturopathic doctor from Washington, and she is the one that I learned about high-dose sulfur therapy from, and so we talk about it a lot in our interview. You can also just look up her website. It's gijanelle.com, so gijanel.com. So she talks about it on there. She has I think an ebook, maybe a free ebook, I can't remember. So, and she's been interviewed by other folks as well. So the punchline is that one takes high doses of MSM, much more than the 1 or 2 grams that most people would usually take in a joint support formula or something like that. And they use that to treat a wide range of different conditions. And so, anyways, I won't recapitulate what's in and I have other videos about this as well, but I won't recapitulate what's in those videos and in our interview. So what I want to share are some of the some of the feedback that I've been getting from patients this week. So recently chatted with a patient, long history of inflammatory bowel disease, and we've worked with a lot of different things, that weren't tolerated, treatments for SIBO, different essential oils, different oral herbs, like just not well tolerated. This patient needed to be on a very, very strict carnivore diet for quite some time. That was one of the only things that helped to get symptoms under control, and then was doing quite well on that, but was really kind of pigeonholed on that carnivore diet for quite some time, and tried working with various things, different gut healing things like glutamine, butyrate. Some things were tolerated, some things not, and things were not really moving the needle a whole heck of a lot. Anyways, there's a bunch of different details with this case, but the patient was doing quite a bit better, but was still fairly limited diet. Really hard to find different supplements that would be helpful or that would be tolerated, I should say. So we started the MSM. Oh geez, I guess maybe 4 or 5 months ago now, and yeah, this patient's doing so much better, able to tolerate more foods, having just further optimization with bowel form and regularity, and just noticing less discomfort with eating, and better appetite, different things like that. So just really, really great to see those clinical improvements, and the MSM was the only new variable that we brought into the mix. The patient's actually not really taking any other supplements, just a few maintenance things here and there, because most things we've tried either he flared from or haven't worked, and so the MSM is really the only new variable in the mix. The patient's also reporting more energy, which is really great to hear, so it's a nice little fringe benefit, and a couple of other kind of side reduction in joint pain as well. So really great to see that, and really happy for this patient, and yeah, so just really, really nice to see that. So and I've seen this in other patients too, where folks who are really sensitive, not able to tolerate a lot of different supplements, the MSM has been tolerated. What was interesting in this patient's case, and also in some of these other patients that were very sensitive, but what I've been happy to see is that a lot of my sensitive patients have tolerated the MSM no problem, which is good. But this patient that I just mentioned, and some other ones, they've actually had flare-ups from starting even with a fairly low dose of MSM. But what I've seen in, I'd say probably 80 to 90% of those cases where the patients have been willing to, give it another try, or sometimes even had to take a second or even a third kick of the can, trying to work with the MSM, starting even lower and going up even slower, is that they've been able to get over that initial reaction. So, come in saying yeah, I tried even the starting dose and I flared up, so I guess this is another one that's not for me. It's well, let's try it at maybe a quarter of the starting dose and see how it goes. And sometimes that's even caused a flare up, so we go even lower. And but the patients who have persevered, 80 to 90% of them have been able to get up to much more robust dosages. This patient in question is almost at the full therapeutic dose, so taking mega dose compared to the initial baby dose that was causing a flare-up in the first place. So yeah, really happy that this seems to be a tool that's maybe not universally going to be tolerated by really sensitive folks, but seems to be a lot better tolerated than a lot of other therapies, and it can be so strong and potent for some of these patients. Another patient I'll just quickly mention here, I see my timer winding down on my video, is a patient where I've been working with this patient for probably about 3-ish years or so. And there are some chronic digestive issues, which we got a pretty good handle on, doing some treatment for SIBO, some dietary modifications as well. And this patient also has a fair bit of muscle and joint pain. So it had an injury some years ago. We've been doing these prolozone injections, so prolotherapy plus ozone injections, and they've been helping. But the patient finds that they need to come in every couple of months to kind of as like a top-up treatment. And we're kind of like seeing this like, general trending in the right direction, but it's kind of more like, there's an improvement and then a bit of regression. So, we do another treatment, there's some improvement and a bit of regression. And the regression is generally not back to the level that it was before the previous treatment, but it's been a bit of a process. We've been working together for a couple of years now, and it's been a bit of a slow process. So anyways, long and short of it is the patient started MSM a few months ago and came in today and said, yeah, like I don't have issues with like my neck's not bothering me now, my posterior shoulder's not bothering me now, my anterior shoulder is a little bit sore, but that's pretty much it. Like that's really all that they wanted some injections for today. It's like, wow, that's really awesome. Plus their digestive function is doing that much better. Their bowel regularity is that much better. Gas and bloating is down. So yeah, I'm really happy for this patient too. And what I foresee for this patient is that hopefully we're just about at the end of our road working with the injections. Maybe we're going to need to do some boosters here or there, but it's just the fact that MSM, it's inexpensive, it's pretty easy to take. Yes, if you're taking it in a powder form, it's pretty bitter, it's gross tasting, but in my opinion, small price to pay to say, hey, if I don't need to keep coming in for semi-monthly injections, if I don't need to if things are actually going to heal, it's like, man, oh man, it's really exciting. So I have other anecdotes that I could tell as well, but I will leave it at those two for now. As just a kind of general recap, or maybe just a general summary of what I've been seeing with MSM, it seems to be the most successful for, or it seems to have the greatest impact, I should say, on chronic digestive issues and on joint pain and muscle pain in some patients. What I've also seen quite consistently is that it helps to improve the strength and integrity of patients' hair and nails. Patients come in semi-regularly saying like, yeah, I started taking a collagen supplement because I want my hair and nails to be stronger and more luxurious. And they find they work sometimes, but with MSM, it's the exception. Sorry, it's been a long day. Getting a little mush-mouthed here. The vast majority of patients see an improvement with the integrity of their hair and nails. It's the exception that patients say that they don't see any change with that, unless they're already perfectly healthy hair and nails in the first place. Then maybe you can't improve on perfection, I suppose. But that's another thing I see very consistently. And then I have seen it help other issues as well. Some patients, like my patient I mentioned earlier here, like better energy levels. Sometimes helps with different skin issues, and probably helps with some other things, but I think my brain's just about done. It's been a long day. So I'll leave it there for now. If you're watching this video and you have any questions about MSM/high-dose sulfur therapy, please feel free to post in the comment section below. If you have any feedback to share about your own experience and you feel comfortable sharing that in the comment section, always interested to hear back from folks about about any topic really, but this topic in particular. And then questions or comments about anything else, just post in the comment section below, and I'll do my best to answer as soon as I can.